As next speaker, we have a very special guest. You all know him. I don't have to dwell on this. You know him as the fascia pope. I know that he hates to be called like this, but he's the director of the fascia research group at the Ulm University, and he is the research director of the European Rolling Associations. He is one of the leading heads in fascia research, and his topic today is Fascination Fascia, the latest insights from international research. For a long, long time, fascia actually were neglected in classical medicine. Thanks to latest measuring methods and an international movement, fascia have become a favorite topic of medical research. What fascia have to do with biomechanical factors, hormonal factors, and collagenous tissue formation will be told you by Dr. Robert Schleip now.
Thank you very much. It's a pleasure for me to be here. Well, fascia pope, well, this is something I dislike because it speaks for a hierarchical transmission of information. I am a fan of fascia. I believe in a horizontal networking dynamics, which is part of our fascia studies and which has spread quite a lot throughout the previous years. I am fully enthusiastic about fascias. Well, fascination, fascia, it's the same root of the word. Well, there is, a tie-up of attention and fashion in the motional apparatus of the body is something that links tissue up. And indeed, in recent years, many things have happened. Well, it's not part of complementary medicine, but in school medicine, it was then tremendously neglected in the years and the decades before. Who, in the past 2 weeks, took a look at the media, couldn't escape sensational news that a new organ was discovered. Spiegel Online, CNN News, all had it. And then in the scientific news, it was discussed as a sensational finding. And indeed, it's an interesting development. We are witnessing there are New York pathologists with most recent imaging procedures. They succeeded in then showing the intramuscular loose connective tissue, and this was published in a high-ranking scientific magazine, a journal, and in recent weeks it was out there quite a lot and being discussed by everybody. Of course, you know the loose connective tissue as a body-wide network. It was known beforehand, so lymph drainage, connective tissue research. Well, who is an expert in that? Is it? They say, well, this is not a discovery of something new, but partly something new was really discovered. And then for a classical school medicine, this is a change of paradigm, so to speak. When you have got the gallbladder operation, we have got a fibrous reticular structure they discovered in the walls, which should actually not exist. And now with a highly modern state-of-the-art laser microscopy, you send in laser beams, you measure the reflection, and based on this, the computer will then construct the architecture of the tissue. So it was confirmed that the loose connective tissue around all organs, and which is there wherever movement takes place, that this reticular structure actually exists, that there are collagen fibers and bundles, where on the one side, when there are cells on the right-hand side, fibroblasts, they are in most of the cases not on the left-hand side. This was a new discovery, and that they are spaces filled with fluid, with liquid, where the lymph gets the fluid from, probably. And what is new is that the fibroblasts, or the cells we see there, that they are not connective tissue cells you would have expected, no, but that they have characteristics like stem cells or endothelic cells. So the connective tissue cells are different from a regular tissue, we know. Now it's called the interstitium. It's the new term which has been been out for 2 weeks. This is the space between the cells, which makes up a body-wide network of loose connective tissue, which in our connective tissue research should be then differentiated from the rough connective tissue, so that it's different characteristics, different cell types, different biochemical features. And the new cells discovered there are similar to another new discovery. And the New York researchers didn't know a lot about this, and that's the so-called telocytes. Here we do not have neurons as people thought in the past. No, they're connective tissue cells. This is fibroblasts. They have got a very small body and long ends, and they specialize in the transmission of signals. They are set up biochemically in a similar way as the cells described by the New York researchers. All we know so far is that, well, in some pathologies, there is a disturbance. You want to pass on as much as possible via transmission, via these fibers. You want to have as many of the telocytes in your body as possible, and a lack of telocytes correlates with several fibrotic pathological characteristics. In November, we will have the Fascia Research Congress in Berlin, which takes place at 3-year intervals, and we succeeded in getting the main researcher from the New York group. We invited him as a keynote speaker, and he is looking forward to an exchange with leading German researchers, the group surrounding Peter Friedl, because they do have a 3-dimensional confocal laser microscopy. And what they succeeded in doing is to follow the movement of fibroblasts in the 3-dimensional connective tissue. They've filmed it live. This is the time lapse. It doesn't happen that quickly in real life. You see that there's not an arbitrary movement of the cells. Partly they move just like here in Fibo. They use a path other cells used before them. So they establish a trodden path, and they continue these paths, and they are called conduits now. And so far, this has only been published in one publication, but in November, this will be one of the key issues at the conference. And probably these paths are identical with what was originally discovered in Korea and further researched in Japan. Before it was thought that it was an esoteric imagination, and now it's the myofascial system. Tiny, tiny little channels in the connective tissue filled with hyaluronic acid, and maybe they give us a new explanation for acupuncture and other phenomena. So you realize that there are many, many things happening out there, and everybody is excited to see what will come out, and everybody's excited to hear about the Congress, which will take place for the first time in Berlin, in Germany, in November. So there are registered openings. Though if you want to attend, don't wait too long. There's a limited number of seats. Then, different from last year, Stefan Müller knew it beforehand. There were critical evidence-based people doubting that the pH value in the basic substance had a clear impact on fascia stiffness, on fascial stiffness. In the past, I only knew this study that was conducted in England, where in an organ bath, the contractibility of the myofibroblasts in living fascia was examined. They contract. The more they contract, the more acidic the pH level in the basic substance. What was questionable is whether this observation could be translated onto the human body. This is not a clear thing, but there's a more recent study where they took a human body, pulmonary fibrosis. When you increase the pH level, the lung fibrosis degrades, gets worse, and this is due to the myofibroblast, a contractive tissue, connective tissue cells. So this applies to lung fibrosis, but it might also apply to other fibrotic processes. stiffnesses. So there I have to say, Stefan from the Glucker College was right. He said, well, that the pH value, whatever impacts the pH value is not only, our diet, but also stress, moderate sports, etc., that this does have a major impact on fascia stiffness, or may have this impact. And what is new is also the understanding of estrogen and how it may impact fascia stiffness. Who, was part of track and field sports, knew that, during ovulation period, when the estrogen level in the woman is very high, she tends to have an injury of the cruciate ligament, and it's a 6 to 8 times higher. So when you can time it, that you have a high level strain, if possible, not on these ovulation days. So when they found out it's not due to the muscles, but it's due to collagen, the fascial connective tissue, that it's softer when the estrogen level is increased. So what came as a surprise is that, how does estrogen impact on collagen synthesis? Collagen synthesis is increased based on estrogen. It didn't make any sense, because more collagen would speak in favor of a firmer cruciate ligament, more robust. And this is something the Copenhagen group found. When more collagen is produced, this is when the estrogen level is high, then the collagen fibers, the collagen 1 fibers are smaller. This is on the left-hand side what the collagen connective tissue looks like with a low estrogen level, and on the right-hand side you've got the high estrogen level. So I would assume that this on the right-hand side is firmer because the cross-section of estrogen is higher, but it's weaker because there are fewer crosslinks. You see them red-colored. So these are the thin cables which connect them. So there are fewer of these crosslinks than on the left-hand side. And then the enzymatic crosslinks that then also increase during sports, they impact on the stiffness, on the robustness of a ligament more than the collagen cross-section, the area covered by them. So this is the explanation. Estrogen increased collagen production results in a weaker connective tissue. Some of you will be familiar with the Helen Laugerer study, most profound, that with chronic back pain patients, the shear movability between the lumbar fascia and the rectus spinae muscles in the passive lumbar flexion, when you tilt the front part and you measure it under an ultrasound head, in a healthy person you see a clear horizontal shear movability. And when you've got a chronic back pain patient, it's more solid. It's this mobility is not there, whether it's maybe due to micro injuries or scar tissue that formed and healing processes that take place, or whether it's simply a result of a lack of motion. The ultrasound cannot find this out for us, but for everybody, not for all of us, but in physiotherapy and in sports, people now look at ultrasound equipment out there in the market. It's very small, handy devices you can carry along in your backpack. I would just wait another year maybe, and this sheer movability, this cannot be quantified yet. They take several hours to do the computing, but with your eyes you can actually see it. And this, at any rate, is a technology telling you, that you have the effect of elongation of stretching exercises over several weeks, how you can, then examine this effect. And I would use FIBO for getting these, small wearable devices. This is Philips. Before I had the Clarios one. You project it onto your smartphone and you get a highly detailed pictures of fascia thickness and movability. Then we do have examination of how strongly an injury impacts adhesion, and how strongly we have an impact of a lack of movement. And there was a study that was taken with pigs. A micro injury was inflicted on the pigs. With the other ones, she didn't have an injury inflicted, but only ensured that there was a lack of movement on the back part due to a harness. And the whole thing resulted in the same level of stiffness of the movement. But when you have got a lack of movement, the effect is much higher. So we, as therapists, as fitness trainers, whenever somebody is suffering from back pain, we should both look at the adhesion in the tissue, so that is actually the healing of the wound, and we should take a look at the lack of motion, because only healing a wound and taking a look at the scar tissue would cover only 50% of what is necessary. It's an interesting thing right here. And last year we had Annika Griefan's study, and she showed with the where she used a black roll, a foam roll, and with a foam roller, she said, with healthy people, you can indeed increase shear movability. Well, this is what I got 3 days ago from her. It's a new study she will introduce at the Berlin Congress in November. She didn't even look at the shear movability of the 2 layers of the back, fascia, versus musculature, and she showed, the foam roller can promote it, but she also took a look at the area between the first and the second back fascia, and there was a sliding movement. She compared the black robe booster with a vibratory core, and the shear movability promotion was significantly increased. It's not published yet, so in November she's going to officially present her study. My favorite topic, fascia as a sensory organ, got a new stimulus given by Professor Martin Grunwald, because he then took a look at the body-wide fascial network, how many sensory receptors we have including the intramuscular connective tissue, this interstitium. And I said a year ago it's more than 100,000 neurons with a conservative estimate. And now we are speaking about 100 million receptors within the fascia network of our body. And this is our richest sensory organ regarding perception. It is one of the richest sensory organs as such, and even exceeds the capacity of the optical nerves of people. It's a small revolution. Back in the 90s, this wasn't known when the first nerve receptors were discovered, and we learned that, during surgery, you should be careful. Then there is an Australian study, and the comparison was conducted between the number of nerves in the lining of the fascia, the intramuscular connective tissue in the background. And here you see it, and then the diagram you can see it, that the innervation density and the skin of the fascia is 3 times as high as that of the intramuscular connective tissue. What is also new is a wonderful study conducted by the Lorimer Mosley group, and in terms of chronic back pain, they examined whether there was a correlation between stiffness, is the back stiffer on the right-hand side than on the left-hand side, and then pressure sensitivity, pain sensitivity. And everybody giving massages would say that wherever the back is stiff, it feels more pain for plausible reasons. But with a chronic back pain, they didn't establish any correlation. So the stiffness of the peripheral tissue doesn't have any correlation with the sensitivity, pressure sensitivity. And then when you take such a pressure pen and you press down with a force of 5 Newton and form a little dent, there is a difference. The chronic back pain patients, they overestimate the stimulus. If they were to tell you how many kilograms, they tell you it's 10, even though it's only 5 kilogram pressure. And so that the smaller differences are more distinctly perceived than, by a healthy individual. So they concluded it's maybe not the tissue stiffness, but the protective orientation of the brain. And they conducted a wonderful study here. The pressure of the digital finger was associated with a sound, a noise. And just listen, when there was a squeaking, alarming sound at the same time, oh, can you hear it? Can you hear the sound? Well, I cannot give you a better one. Then, in particular, the back pain patients, had a very high pain sensitivity, and they massively overestimated the strength of this pressure. Also, the healthy individuals did so, but even more so the chronic back pain patients, when there was a different sound like this one, while the pressure was exerted. It's like breathing out. It's all fine. It's all well. This had a dramatic effect. It has a dramatic pain relieving effect. And now, a provocative thesis which is out there. Maybe what I do is, I do not soften the tissue. Pain doesn't care about that, but the brain feels it's not alarming. It's not dangerous what's happening there. When I move over a certain spot several times with a soothing, calming voice, I tell the patient it's getting softer or not, no matter whether I'm lying or not. But the brain moves away from this danger, a perception mode into a reassuring, calming mode. When I've got stretching, extensions, maybe, this is then associated with a neuronal change with chronic back pains and not with a tissue which gets softer. But this seems to be different with acute neck pain. There are older studies that showed indeed that the more painful side is really also the one with hardened tissue. So it's not the clear thing we can generalize too much. And then, most recent study is that the impact of stretching over a longer period of time was then analyzed. Studies lasting longer than 4 weeks were taken here. The finding is that it's a most efficient way to stretch one muscle group over a week for 5 minutes. It's whether you do it 1 minute or 2 minute ones, the individual stretching didn't have any impact. But when I want to have my hamstrings for a longer time, it would be ideal when I stretch my hamstring for a period of 5 minutes per week, and in an optimum way 5 times a week, Monday to Friday. Extend your hamstrings once a week, then I've got the maximum result in terms of movability. If this is important to me, and there is no distinction between doing it 10 minutes or 7 times a week or 20 times a week when I do these extension exercises. 5 times a week, 5 minutes maximum, distributed over the week. And then, this takes me to the end of my presentation. This is the intramuscular connective tissue. This is what you see, a young, untrained individual, and on the right-hand side, a trained individual. Training gives you less adhesive tissue, and then when you are getting older, there is less connective tissue. It's a great piece of news. Somebody who's old, like me, doing sports does have a younger fascial architecture than a young couch potato. Isn't that a great thing to find out? So here this is the young couch potato. This is the young untrained, and I can compete with them. Yes. So sports can really completely offset the age effect in terms of this particular parameter. So if you want to know more, I will be here for those who are very keen on networking, on knowing more. I think that, you learn most by way of networking. And then here register in time for the Fascia Congress in November. Thank you very much for listening.
So, thank you very much, dear Robert, for your fantastic, fascinating presentation on fascia. May I ask you a question? The fascination about fascia never stops. How often do you work on your fascia?
My own fascia, I make sure that I do it on a daily basis. Yes, indeed. Or 5 times a week. So 2 days a week you can do and relax.
So 5 times a week and 1 minute.
So, when you want to have maximum movability and motion.
Great. This is a fantastic outlook. Thank you so much. And ladies and gentlemen, dear guests, if you should have any questions, Dr. Schleip will be around for some more minutes. He will be in our VIP settee, and you're free to ask him questions.